Welcome back to my channel. If you're new here, my name is Neil Galve and I'm a registered nurse and I do have a degree in medical surgical nursing. I create my nursing educational videos to help nursing students and nursing professionals like you with their studies. If that is something that you are interested in, please make sure to subscribe now and hit the notification bell so that you will be the very first to watch my newest uploads. Also, don't forget to give this video a big thumbs up and share with your friends because that will really help know that you like to see more contents like this. Without further ado, you guys, let's jump into the video. Hi everybody! Isang panibagong nursing video nga ang alay ko sa inyo for today. And I just want to greet you wherever you are right now, whatever time zone you're watching me right now. I love you. I'm proud of you. And I wish you the best in life. Okay? Okay. Now, kung hindi mo pa napapanood yung entry natin yesterday where I discussed to you, I give you a lecture material regarding the nervous system. That's going to be a part 2. I'll be putting the actual playlist link on the description box. It's in the playlist of anatomy and physiology. I actually have tons of lecture materials regarding anaphy and a lot, if not hundreds of lecture materials regarding nursing, from nursing test banking, cheat sheet, laboratory values, nursing care plan, nursing leadership and management, fundamentals of nursing, medical surgical management. What's this? I also have pre-hospital nursing. Ang dami na nga, nako. Oo nga no, ang dami na pharmacological, nursing pharmacology. Panoorin mo yon because that is all for you. I just also want to grab this opportunity to thank you who is listening right now. Maraming salamat sa pagbalik mo at pakikinig mo at pagsuporta mo sa channel ko. Gusto kong malaman mo na na-appreciate kita. Kung nasaan ka man ngayon, I love you. Kung nasaan ka ngayon sa buhay mo, I love you and thank you. Thank you for all your support. We're actually moving towards 20,000 subscribers. I'm really hoping that by next month we're gonna hit that 20,000 mark. And I know that in this channel, in Team Galve's channel, nothing is impossible. So keep supporting my channel, keep sharing my channel para mas marami tayong matulungan. Mapadali yung pag-aaral nila, mas lumago itong service content na ginagawa ko for all of you guys. Thank you po. Don't forget to follow me in all my other social media accounts. The links will be on the description box. A special announcement. I have a 3 a.m. conversation podcast channel where I actually talk about mental health, spirituality, wellness, loving yourself more, all of that good stuff that deals towards self-expression and becoming the truest and highest version of yourself. So if you haven't checked out or if you haven't listened to the podcast, it's 3 a.m. Conversation with Neil Galve. The link is going to be on the description box. It's available exclusively on Spotify and Anchor. All right? So, ito nga ay another entry natin sa atin nursing test banking. And like I said earlier, I have tons of lecture materials regarding nursing test banking where I introduced you to the possible questions that you may come across sa PNLE, sa NCLEX, sa PROMETRICs, at sa kung ano-ano pang exam natin sa nursing. And this is one of them, Medical Surgical Nursing NCLEX Practice Exam. Here, I'm going to teach you how to attack certain questions and how to rationalize them. Para pagdating ng araw ng examination mo, whenever you encounter such questions like this, or let's pray to God that this is the exact same questions that you're gonna be having on your NCLEX examination or PNLE examination, whatever that is, you have to get this one right because that could make or break the result of your examination. All right? So, eto na talaga tayo. Let me proceed by sharing you the objectives for our today's examination. So I'm going to provide to you and discuss to you board exam type of questions And then I'm going to rationalize per each board exam type of questions. If there's one thing that I want you to take away every time we do a nursing test banking video, that is the rationalization. I want you to have the full grasp of the rationalization, because whenever you know the why, that is the right answer, there's no way you will forget about it. It will always be with you. All right, that's how you're gonna approach this exam. So let me share to you the instructions. You'll be given 10 board exam type of questions, or in this case, NCLEX type of questions. I'll be reading the questions and the choices for you. You have 5 seconds to answer each question. The answer is revealed instantly after each question with rationalization. Choose the letter of the correct answer. Good luck, nurses. Handa na ba kayo? Handa na. Hihinga lang ako. Huminga ka na rin. Let's proceed with our NCLEX type of question number 1. Mr. Braga was ordered digoxin 0.25 milligram OD. Which is poor knowledge regarding this drug? Tinatanong ka, alin daw dito ang negative statement regarding digoxin? Period. Poor knowledge regarding digoxin. A statement that will be given by Mr. Braga that indicates that he doesn't know what is this medication for, the actions, the indications and contraindication, those stuff. Is it A, it has a positive inotropic and negative chronotropic effects? Is it B, the positive inotropic effect will decrease urine output? C, toxicity can occur more easily in the presence of hypokalemia, liver and renal problems. Or D, do not give the drug if the apical rate is less than 60 beats per minute. Your 5 seconds starts now. Time is up, you guys. Time is up. Okay, what is your answer? Very good. Letter B. The positive inotropic effect will decrease urine output. Inotropic effect of the drugs on the heart causes increased force of its contraction. This increases cardiac output that improves renal perfusion, resulting in an improved urine output. Malinaw ba yun? Malinaw. Question number 2. Valsalva maneuver. Familiar ba kayo sa concept ng Valsalva maneuver? Here's the picture. Use it for your advantage. Valsalva maneuver can result in bradycardia, decrease in heart rate, right? Which is a numerical value that is below 60 to 100. Gets? Beats per minute. That's your unit. Which of the following activities will not? Ito. Negative statement. Negative question. Activities that will not stimulate Valsalva maneuver. That's the question. Is it A, use of stool softeners? B, enema administration? C, gagging while toothbrushing? Or D, lifting heavy objects? Your 5 seconds starts now. Time is up, you guys. What is your answer? Very good. Use of stool softeners. Use of stool softeners straining or bearing down activities can cause vagal stimulation that leads to bradycardia. Use of stool softeners promote easy bowel evacuation that prevents straining or the Valsalva maneuver. That is their answer. All right, let's proceed. Board exam type or NCLEX type of question number 3. The nurse is teaching the patient regarding his permanent artificial pacemaker. Which information given by the nurse shows her knowledge deficit about the artificial cardiac pacemaker? Knowledge deficit. Poor knowledge regarding artificial cardiac pacemaker. Kung hindi ka pamilyar sa concept ng cardiac pacemaker, and if you want me to do a lecture material regarding that, let me know in the comment section below. But the choices, let me read them to you. A, take the pulse rate once a day in the morning upon awakening. Poor knowledge, huh? B, may be allowed to use electrical appliances. Is it C, have regular follow-up care? Or D, may engage in contact sports. Your 5 seconds starts now. Time is up. What is the answer? Very good. Simple. May engage in contact sports. This is not true for patients who have artificial cardiac pacemaker. Why? The client should be advised by the nurse to avoid contact sports. This will prevent trauma to the area of the pacemaker generator. Malinaw ba yon? Malinaw. Question number 4. A patient with angina pectoris, chest pain, in layman's term, is being discharged home with nitroglycerine tablets. Nitroglycerine tablets. Mark it down. You see how I am approaching and attacking the questions? I'm underlining keywords. Which of the following instructions does the nurse include in the teaching? Kapag ang pasyente mo daw na merong angina at na-discharge home na merong discharge medication na nitroglycerine, ano ang i-include mo sa teaching mo in relation to these concepts that are included in the question? Is it A, when your chest pain begins, lie down and place 1 tablet under your tongue. If the pain continues, take another tablet in 5 minutes. Is it B, place 1 tablet under your tongue. If the pain is not relieved in 15 minutes, go to the hospital. C, continue your activity, and if the pain does not go away in 10 minutes, begin taking the nitro tablets 1 every 5 minutes for 15 minutes, then go lie down. Or D, place 1 nitroglycerine tablet under the tongue every 5 minutes for 3 doses. Go to the hospital if the pain is unrelieved. Your 5 seconds starts now. Drug administration to ng nitrogly. Malinaw ba yun? Oh, time is up. So meaning, avoid mo dito, iwasan mo ang toxicity, interval of administration, pati ang dose of administration. Hence, the correct answer is very good. Letter D. Place 1 nitroglycerine tablet under the tongue every 5 minutes for 3 doses. Maximum. Go to the hospital if the pain is unrelieved. Angina pectoris is caused by myocardial ischemia related to decreased coronary blood supply. Giving nitroglycerin will produce coronary vasodilation that improves the coronary blood flow in 3 to 5 minutes. If the chest pain is unrelieved after 3 tablets, there is a possibility of acute coronary occlusion that requires immediate medical attention. Period. Nakuha ba yon? Nakuha. Nangangalahati na tayo, and here we go with our question number 5. A client with chronic heart failure has been placed on a diet restricted to 2,000 milligrams of sodium per day. Meron siyang anong diet niya? Sodium restriction ng 200 milligram per day. 2,000 milligram per day. The client demonstrates adequate knowledge, meaning positive statement ang hahanapin mo if behaviors are evident such as not salting food and avoidance of which food. Itong tanong. Kung meron kang sodium restriction, kahit hindi mo alam kung gaano karami yung 2,000 milligram. Sodium restriction, alin sa mga pagkain na ito ang iiwasan mo? The picture may give you a clue, but just in case you don't have a picture on the board exam or on the NCLEX exam, here's how you're gonna attack the question. Alin dyan ang iiwasan mo na mayaman sa sodium? Is it A, whole milk? Is it B, canned sardines? Is it C, plain nuts? Or D, eggs? Your 5 seconds starts now. Time is up, you guys. What is the answer? Very good. Letter B, canned sardines. Maalat. Canned foods are generally rich in sodium content as salt is used as the main what? Preservative. Para hindi masira yung sardinas, lagyan ng maraming asin, may sodium restriction, ibibigay mo sa pasyente o ibibigay mo sa tao? Hindi. Kaya ang sagot, canned sardines. Before further proceed, kung hindi ka pa nagsasubscribe, mag-subscribe ka na, pang palaki charm this year. Alright? Nakakaya naman sa'yo. Eto na. Next. Question number 6. A student nurse is assigned to a client who has a diagnosis of thrombophlebitis. Which action by this team member is most appropriate? Appropriate action sa mga pasyenteng may diagnosis ng thrombophlebitis. Alin? Dito. Is it A. Apply a heating pad to the involved site? B. Elevate the client's legs 90 degrees. C. Instruct the client about the need for bed rest. Or D. Provide active range of motion exercises to both legs at least twice every shift. Your 5 seconds starts now. Time is up. What is your answer? Very good, nurses. Bed rest ang tamang sagot. Why? Listen. In a client with thrombophlebitis, bed rest will prevent the dislodgement of the clot in the extremity, which can lead to pulmonary embolism. Bakit maglilid sa pulmonary embolism? It can travel through the bloodstream and reach the heart or reach the lungs. Ayaw mo nun? PE. Nako. Kaya ang sagot, bed rest sa mga merong thrombophlebitis. Let's proceed. Question number 7. A client receiving heparin sodium asked the nurse how the drug works. Which of the following points would the nurse include in the explanation to the client? Explanation mo kung paano gumagana or ano ang mode of action ng heparin sodium. Period. That is the question. Sa isang pasyente, layman's term. A. It dissolves existing thrombi. B. It prevents conversion of factors that are needed in the formation of clots. C. It inactivates thrombin that forms and dissolves existing thrombi. Thrombi ha, singular. Thrombus, plural. Thrombi, plural. Thrombus, singular. Or D. It interferes with vitamin K absorption. Your 5 seconds starts now. Time is up, you guys. Kung masyadong mabilis yung 5 seconds, you can pause this video and just give you more time to think about it. But I really want you to practice spotting the questions, the keywords right away, and reading as fast as you can. The time whenever you take any type of examination, NCLEX or PNLE, CBT, or OSCE, time is your best friend. So, you have to maximize your time. The answer to this one, though, is letter B. It prevents conversion of factors that are needed in the formation of clots. Heparin, remember this, is an anticoagulant. It prevents the conversion of thrombin to thrombin. It prevents the conversion of what? Prothrombin to thrombin. It does not dissolve clot. Conversion ng prothrombin to thrombin, that's what heparin do. It inhibits the conversion of prothrombin to thrombin. That's the action of your heparin sodium. Alright? Okay, doke. Now, mag-proceed na tayo. Nakakarami na ba kayo ng tamang sagot, you guys? Kumusta mga scores nyo? Don't forget to write your scores below, ha? I would like to evaluate the scores of my students. No shame, no shame. Pinaghirapan mo yan. Alright. Next, question number 8. The nurse is conducting an education session for a group of smokers in a stop smoking class. Stop smoking class. Nagkoconduct ka ng educational session. Which finding would the nurse state as a common symptom of lung cancer? Itong tanong, disregard mo na yung situation sa taas. Ito lang talaga yung tanong. Common symptom of lung cancer. Period. Ang pahirapan ng sarili mo. Is it A, dyspnea on exertion? Is it B, foamy blood-tinged sputum? Is it C, wheezing sound on inspiration? Or D, cough or change in a chronic cough? Excuse me, your 5 seconds starts now. Time is up, you guys. What is the answer? Very good. Letter D, cough or change in a chronic cough. Cigarette smoke is a carcinogen that irritates and damages the respiratory epithelium. The irritation causes the cough, which initially may be dry, persistent, and unproductive. As the tumor enlarges, obstruction of the airway occurs and the cough may become productive due to infection. Period. Last two questions, make this one count. NCLEX type of question number 9. Which is the most relevant knowledge? Relevant knowledge about oxygen administration sa mga pasyenteng COPD. Coronary obstructive pulmonary disease. Ano mga good example nito? Asthma, emphysema. Alright? Okay. Ano ang ilalagay mo sa utak mo kapag every time nagbibigay ka ng oxygen administration sa mga pasyenteng COPD? That is the question. Is it A, oxygen at 1 to 2 liter per minute is given to maintain the hypoxic stimulus for breathing? B, hypoxia stimulates the central chemoreceptors in the medulla that makes the client breathe. C, oxygen is administered best during a non-rebreathing, using a non-rebreathing mask. Non-rebreathing agad. Gigil ako sa'yo. Is it D, blood gases are monitored using a pulse oximeter? Your 5 seconds starts now. Time is up. What is your answer? Sa mga pasyenteng may COPD, common na common ito. Anong dapat mong tandaan? Letter A. Oxygen at 1 to 2 liters per minute is given to maintain the hypoxic stimulus for breathing. Listen to this. COPD causes a chronic CO2 retention that renders the medulla insensitive to the CO2 stimulation for breathing. Ano ba yung ano ba yung stimulus for breathing natin? Hindi oxygen, kundi carbon dioxide. The hypoxic state of the client then becomes the stimulus for breathing. Giving the client oxygen in low concentration will maintain the client's hypoxic drive. Period. Last question of the day. Make this one count. Question number 10. When suctioning mucus from a client's lungs, which nursing action, concept ng suctioning, nursing action will be least appropriate. Meaning, sa apat na ito, alin dito ang hindi mo gagawin o ang hindi akma? That is the question. Letter A, lubricate the catheter tip with sterile saline before insertion. B, use sterile technique with a two-gloved approach. C, suction until the client indicates to stop or no longer than 20 seconds. Or D, hyperoxygenate the client before and after suctioning. Your 5 seconds starts now. Time is up. What is the answer? This is based from research, you guys. The answer is letter C. Suction until the client indicates to stop or no longer than 20 seconds. Why? One hazard encountered when suctioning a client is the development of what? Hypoxia. Why? Because whenever you do suction, bear this in mind, you not only remove the secretions, you also remove the oxygen. Kaya importante yung pre-oxygenation and post-oxygenation ng pasyente before and post-suctioning. Alright? Now, suctioning sucks not only the secretions but also the gases found in the airways. This can be prevented by suctioning the client for an average time of 5 to 10 seconds and not more than 15 seconds, and hyperoxygenating the client before and after suctioning. What did I tell you? Thank you so much, you guys, for watching. I hope you learned something today. Write your scores on the comment section down below. Let me know your scores. Let me know what you learned something about today. Please like, share, and subscribe to my channel for more nursing educational videos. Let me know if you have other nursing topics that you want us to do. You comment it down below. Abangan nyo nga yung next video natin for next week because that's going to be another series, another week of nursing lecture. Maraming salamat sa pagbalik nyo sa online class natin for today. And I see you. I appreciate you. Tulungan nyo na nga ako, ipamalitan nyo na sa radyong sira ang pinakabago, pinaka-fresh at ang pinaka-libreng nursing review center sa balat ng YouTube. And don't forget to follow me on all my other social media accounts. Everything is at Neil Galve except for my TikTok account, which is Neil Galve Official. Follow me and subscribe and share my Facebook page. It's Neil Galve. Follow and subscribe. Listen to the podcast show. It's 3 a.m. Conversation. Exclusively on Spotify and Anchor. The links to all my social media platforms is on the description box. Check them out. It's all for you. Let's connect. And thank you so much again for joining me for today's class. I love you. I see you, and I am proud of you. Have a good one.